Salford, coming from Sweden, also a very experienced researcher in the field. Especially in Sweden, we are expecting new work. Usually Sweden has a different approach to this risk research. We have seen many results in the past coming from Sweden, like the fact that your computer terminals and your screens have a high frequency. This is work that has been done years ago in Sweden. I believe, at least. Today we are going to hear Leif Salford talking about other not cancer-related EMF health risks.
Thank you very much. Thank you. That's the pointer.
This is your pointer right there.
This little thing here. Yes, I can see
and
it.
then advancing, press that.
Thank you very much. Yes, I try to go forwards, right. Well, ladies and gentlemen, friends, it's a great pleasure to be here, and thanks for the very kind and nice invitation by the organizers. As you can see, what I will report here is research from Lund, which has taken place during the last 21 years, and which is all based upon results upon rats, and in few cases cells. So that's the basis, that's what we want to bring into mind. Rather long ago, I said that this was the largest experiment ever in the world, a biological experiment. And the fact is that today, almost 2/3 of the world's populations volunteer as guinea pigs in this, the world's largest biological experiment. Dramatic, and there is no controlled population anymore because they are everywhere. And we should remember that we live in a very thin habitat. It's only 80 kilometers above us where we are underneath the ionosphere. And the Earth radius is 4,600 kilometers. So it's a very thin habitat which we have to live in and to survive in. And only microwaves from the Big Bang, 5 billion years until 1940, reached the Earth. The Earth is about 4.5 billion years old. And that's what has happened to us until very recently. Then came Sir Robert Watson Watt with his radar, and was followed by the guy who had his candy bar in his pocket when it melted, when he sat with the radar, Dr. Percy Spencer, who introduced the micro oven to us. And then came the mobile phones. You said Sweden was early. The original mobile phone you can see there, down to the left, that's from Ericsson 1956, but after that everything had turned into smaller and smaller devices with all these base stations. And the important message on this slide is that microwaves today is 10 to the 11th, up to 10 to the 18th times more than it ever was before 1940. That's a silly little thing there, yeah. What effect can they have upon the living organism? Well, the living organism came on board on this Earth. 50 billion years ago we had a Big Bang. 5 billion years ago the Sun. 4.5 billion years ago the Earth came around. And 3 billion years ago, a little bit longer than that, the earliest unicellular life came on Earth. And then happened all this you can follow. And 2 million years ago, Homo sapiens came around. So this is a very late event. And it's during that time that all this new has happened. We concentrated very early in Lund upon the effects upon the blood-brain barrier. And why did a neurosurgeon, I should mention that I've been a neurosurgeon since 1967. So why did a neurosurgeon go into this very odd business? And the thing was that we had read the papers by Shivers et al., a very fantastic group in London, Ontario, who were very early in this field, and they showed that the new MR machines opened up the blood-brain barrier of rats that were sneaked in during the nights in the patient's machine when the patients were not there. And I went there in order, hopefully, to be able to control chemotherapy against the gliomas, which was my major interest in my research since 1977. And my hope was to utilize these fields in a clever way in order to improve the finding of the guerrilla cells, the migrating cells from the tumors, the glioblastomas, out in the brain. And my friend, Professor Persson in radiophysics, with whom I've worked all these years, he went there because he built the first MR machine himself in Sweden, and he was interested to see if it's really true that it might be dangerous to people. Well, this is the glioblastoma multiforme, which I have been dealing with all my life almost and trying to cure. I haven't succeeded so far. Normal brain tumor, horrible tumor. It grows like an octopus in the brain. It sends its small guerrilla cell nests out into the brain. And whatever you do, even if you take away the whole hemisphere, But for the basal ganglia, there is always a continuing growth in the other half of the brain. So it's a horrible disease. My hope was then to reach these glial cells by help of these fields. It didn't work out that way, but I learned a lot about these fantastic fields, which really makes a difference to rats. And we learned during the first years, we repeated what they did in London, Ontario. Then we continued with the studies with immunostaining for albumin and also for fibrinogen. We used the pulse modulate 9 or 15 megahertz microwaves. And since 1998, we have used the GSM telephones, the genuine telephones, both for the 900 and 1800 exposure. So this was what we repeated from the experiments in London, Ontario. You can see this is a control, and here you can see how much leaked out of the vessel in the MR-exposed animals. And here's another slide of the same situation, the vessel here and the surroundings. And that intrigued us quite a lot. Much of this, of course, depends upon what is the blood-brain barrier. There are such barriers between the brain and the blood, between the testis and the blood, between the follicle in the ovary and the blood, and the eye and the blood. So these organs, so important to us, are shielded off by special barriers. And the one in the brain and the eye is based upon the fact that this is the lumen of the capillary, the wall of the capillary, and there are very tight junctions between the cells, so things have difficulty in just leaking out. And also there's a second layer, the basal membranes, and then you have all these end feet of the astrocytes, which form the second barrier in this field. I can't go into details, but as it meant so much in our research, the fact is that the blood-brain barrier is a very essential factor here. And do our rodent blood-brain barriers really look like the human situation? The answer is very much so. And very recently, only months ago, there was a publication telling us that there are differences. There are differences between us. So here you can see the rodent BBB, and here you can see the human one. The human is very well covered by the astrocytic protrusions and their end feet, all the way as a thick, good layer. You can see close up here. When the rodent, they're more rosette-like. So the layer of the astrocytes covering the small capillaries is not as well covering as it is in the human side. This is new information, came only, as I said, half a year ago. So, and I'm happy to be the one who can refer to it, because I think this is, of course, very important to know if there are differences, because what we say has to be interpreted as possibly detrimental or bad or good, whatever, to the human situation. We've used these TEM cells based upon research here in America, but built back home in Sweden, the TEM cells, transverse electromagnetic transmission cells, which we use all the time. Much debate has been around whether they are good enough and if they really are stable enough, because our rats are moving freely in these cages. Not too much freely, because it's not a very large space, but good enough to turn around for the little rat. As you can see here, that's a rat of the normal size. He can move around in there while he's under exposure. And that is much debated by those who want to criticize this, that we can't know exactly how much reaches the brain, which is the organ of interest to us. But we measure how much goes in there when you have closed the cage with this little door. And this is the way how we can calculate how much comes out. And of course, this is a Faraday type of cell, where the septum in the middle is the one half of it, and the other part is this net which forms the cage. We made a huge amount of experiments for this before 1997, and this was published in 1997 in the Persson et al. Paper. And there's more than 1,600 rats in those days, and we exposed most animals for 2 hours, but a few of them for 2 minutes, 15 minutes, 1 hour, and most again 2 hours, and a few even up to 16 hours. And then they were examined within 30 minutes in almost all the cases, but also in a few cases up to 16 hours after exposure. So this is what it looks like in a control animal, a sham animal. She sat in this machine, one rat upstairs, one downstairs, and out comes such a control animal. There is always an inbuilt control, where albumin here, stained by the rabbit anti-rat albumin, shows that in the hypothalamus you have an area where there is always an uptake, a normal taste, where the brain tastes what is in the blood. So this is normal. It's true also in the human being. We have the same type of area in our brain where there is a free passage without doing harm to us.